Hi, my name is Travis Boss. I'm one of the nurse practitioners and I work at University of Maryland, Baltimore, Washington Medical Center. I do a little bit of everything, so a combination of physicals and a combination of med management associated with complex diseases, and also as well as doing like physicals for jobs, for school, all of those sort of things. In my previous life, I was a medic for the Army for about 8 years. I then recommissioned as a nurse and started working at shock trauma. I worked in the ICU for about 7.5 years. And then at about the 5-year mark, I was like, you know what? I really want to do more preventative medicine. So I went back to school, got my nurse practitioner license and my doctorate, and I started working in primary care. I try very hard to build a very supportive relationship with my patients as well as a collaborative relationship. I find that when the patient trusts me, they're a little bit more open with me and they're willing to share more information about whatever is going on in their life, whether it's their struggles at home or their struggles with whatever disease they're dealing with. So I try to make sure that they feel heard. So we do your annual checkups, we do your annual lab testing, we do your monthly, your 6-month, whatever the case may be, to make sure that whatever your diagnosis might be is being taken care of in an effective way, so that you don't end up in the hospital because you're having headaches from having uncontrolled blood pressure, or because of an infection that you saw that you're like, I don't really know if it's an infection. The nice thing is you can reach out to your primary care provider and you can be like, hey, can you take a look at this? And we try and find the time to make sure that we do that for them. Honestly, the best part about what I do is getting to talk to people. Like I said, prior to this, I was in the ICU for 7 years and my patients were intubated and sedated. I didn't get to have conversations, and I really, truly like talking with my patients, because you don't really get to know what's going on with people unless you're able to talk with them. Here, I actually get to see the person and I get to hear the experiences. I get to help them work through just getting better, or help them figure out how to get better. That and the really cool medicine I get to practice.